What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, having a great day, and of course testing negative for all those viruses. It is time now for the Friday edition of the Virus Update for Friday, August 22nd, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's a lot of viruses out there. The United States is currently in a COVID surge, which continues to grow. Back to school portion of the surge now, yes, back to school, back to college. It's a big back to college weekend all across the United States, and that is contributing to more cases. Want to stay informed with that and all the other viruses? Subscribe down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Already, we do have several news stories today. It's a very busy news day. We do have some new data. Believe it or not, there's actually a delay in some of the CDC data. Yeah, no surprise there, or maybe to some it actually is a surprise. No, it's this day and age with the CDC. You know the drill. Already starting off with St. Louis. Yes, a place we haven't talked about in a while. COVID cases are on the rise in the St. Louis area, and they are reporting that COVID cases are going up. And get this, they have seen a positivity rate at one of the urgent cares go from 5 to 17%. Yeah, urgent care centers in St. Louis are reporting an uptick in COVID cases, although that's more than an uptick. That's a pretty large increase. The local positivity rates are going up in the St. Louis metro area. And already it has been a bad year for the viruses. It says here, Jefferson County, Missouri, recorded 14 flu deaths and 20 COVID deaths during the same period. Also this year, St. Louis County has 38 flu deaths and 105 COVID deaths this year. Yeah, that number's still up there. People are still dying from COVID here in the United States and all around the world. COVID never ended. All right, speaking of rising rates of COVID, California, this was from Sci-Fi yesterday. He may have posted this after we already did our update. I don't know. Nonetheless, we got it today. California reports COVID positivity skyrockets to 15.9%. And there's a reason why I say skyrocket, and he says skyrocket, because in the Bay Area, that's in the Bay Area, higher than 2023, higher than 2024. Now, that sounds alarming, and I think it is misleading to some people when we say, oh, it's higher. Okay, it is. You have to understand something. Number one, these guys right here, at-home testing. And number two, probably a bigger issue. People just not getting tested. Oh, it's just allergies. Oh, it's just a cold. Because for some people that have very minor symptoms when they test positive, very minor symptoms when they have COVID, they don't test positive because they're not testing. That's the problem. A lot of people with minor symptoms say, oh, it's no big deal. Well, it could be. What's minor for you could be transmitted to someone else and could be major for them. So, yeah, this is a problem. And even some that are very sick are just not testing. Take a look at this COVID positivity rate. Look at it. It is literally almost going straight upward at this point. Yeah, this is not good whatsoever. So, yes, California continues to get worse. You'll see some of the CDC data, California as well. Now we move on to measles, hence why we went with a thumbnail today. The viruses are out of control. We're talking about several viruses today, not just COVID. In Mojave County, this is in Arizona, hope I'm saying that correct, county reports 9 confirmed measles cases in Colorado City area. Health officials conducting contact investigation. You know, back in the early days of COVID, we did contact tracing. It's very similar. And urging vaccination to prevent further spread of highly contagious disease through Arizona community. So, yeah, this is not good. I mean, brand new outbreak right off the bat. 9 cases. Yikes. Measles continuing to be a problem here in the United States. Wisconsin is finding that measles is continuing to go up as well. Total cases now up to 14 cases, I believe, in the state of Wisconsin. So, yeah, measles still a problem there. However, we move over to Kansas, and Kansas reports that their measles outbreak for 2025 is done and over with. They saw what Texas did and said, you know what, we'll say ours is over with too. Yeah, but nonetheless, they did have several measles cases in the state of Kansas. In fact, in a month since the state reported a total of 87 cases, officials say 80% of the cases were children, and more than 90% of the cases involved people who were not vaccinated against measles. That's something that continues to be a problem. The WHO? Yeah, the not vaccinated. But we have to talk about the WHO, too. Yes, the band, the WHO. Unfortunately, had to cancel their show they were supposed to do here in Philly last night, and I'm also hearing, I think they were supposed to go to Atlantic City as well, and, well, that's being canceled for now. It'll be postponed, so we hope, I guess, because this is their farewell tour. You know, the WHO, these guys have been out there touring. When did they even start? 1969, 1970? I think they started in 70. They weren't at Woodstock, but you get it. These guys have been out there. They've been doing their thing for years. Now they're ready to retire, and right when they're ready to do their final farewell tour, yes, final farewell, they also did another farewell tour back in the 80s, and, well, they continued on. But the point I'm trying to make here is it's not going so well because they just kicked off the U.S. portion of this tour, and, well, now they're dealing with illness. They're not saying who it is. Get it, the WHO. But they're not saying who it is within the band, but they are dealing with illness. This is there. Here you are. It's something we see so often. And one of them is sick. Hopefully it's not more than one of them. We've been seeing many people sick lately. This will make it into the list of performers who are sick. I don't recall. Did I add this one yet or not? I don't remember. I don't think I did. Legionnaire's disease has been a problem in portions of New York City and central Harlem, and it's still a problem. 111 confirmed cases, 6 deaths, and 7 people currently hospitalized. People usually develop symptoms 2 to 10 days after exposure, though it can be as long as 2 weeks. So, with that in mind, there could be more cases that pop up, more hospitalizations, and could there be another death? I suppose there could be more. All right, moving on now to, I believe this is Indiana? Yeah, Tippecanoe County, Indiana, at the McCutcheon High School has paused freshman football practice this week after several confirmed and suspected cases of no, not COVID, no, not measles, no, not Legionnaires. This time it's hand, foot, and mouth disease that's a problem. I told you, the viruses are out of control. Yeah, hand, foot, and mouth disease. And, well, obviously, you know, football is a very hands-on sport. You're tackling, you're throwing the football, all those different things happening, and you can't have that during a football game. So, yes, high school in Tippecanoe County, Indiana, is dealing with hand, foot, and mouth disease. And in case you're wondering, this will make the thread because it's something that involves a school, so it'll make that thread there over on my website. I think there's something else I did not add yet. I don't even remember. I have so many tracking threads at this point. While we're on the subject, it's that time again. Do you know of kids who have gotten sick from going back to school yet? Now, I did post this a little early, and because I did that, I'm going to post this again probably a week or two after Labor Day, just to see what pops up. But 59% said yes, 41% said no, only 78 votes, and someone said voted no because school hasn't started yet. The reason why I posted, we've been getting comments here, I've been seeing stuff on social media of people saying, yeah, we know of people sick, and of course, I've already seen some news stories. Yeah, so, yes, people do know of people getting sick from the back to school, and reminder, it is back to college. I mentioned this at the beginning of the video. It is back to college weekend, which is a big deal. I know I saw Penn State University earlier. It's absolutely packed up there. It's packed in these college towns. You know, you're moving in, you're moving stuff around. Parents are dropping the kids off. They're staying at hotels. That is going to just keep this COVID surge going. We got a few more weeks. Then we have Labor Day weekend. So we're probably looking at a peak for this summer COVID surge. Somewhere, my guess would be somewhere in the second week of September. But mind you, not every region, state, city, town, local community is going to be on the exact same date. Somewhere it could be a week earlier, somewhere it could be a week later. Florida definitely could be earlier. So we are coming near the peak of this wave soon, but we just got to get through a few more weeks, and then we have to wonder what comes fall time. Over in New Zealand, In case you did not know, it is wintertime over there. Well, sickness and reliever shortage forces schools across the country to close. Here we have substitute teachers. I guess they call them relievers over there. And there's a shortage of that because there's so many people that are very sick at this time. And there's just not enough people available to teach the kids at this time. Yikes. That's not a good thing. Since we're on the international front, let's take a look at this. Dennis, the COVID Info Guide. Victorian Weekly Respiratory Surveillance Report. August 22nd, 2025. From August 10th to August 16th. That's where this date is from. COVID positivity rate, 3.1%. That's stable. COVID cases, though, did go up. 842. That's up by 12%. Influenza A, yikes. 2,222 cases, up by 2%. Influenza B, 1,439, up by 5%. RSV, 1,357. That is stable at this point. And at this point, someone is probably saying, oh, well, COVID's just like the flu. Okay, COVID can go on to long COVID, and, well, who here has had a case of the flu as of lately? I haven't, but let me tell you, the last time I did have, or at least suspected case of the flu, which we're going back about 10 years, that was no picnic either. Who wants to be sick in general? Why even try to get sick? No one wants to be sick. Okay? Alright, moving on. Taking a look at the website. Nothing really to show you here. I'm going to update some of these threads either this evening or tomorrow. Some of this stuff will get shown on that new vlog format we do for the Sunday videos. I think we're doing that this week. I don't know. I don't know how that's going to go just yet, because I told you, CDC wastewater has not really updated. Taking a look at what's going on in Canada. The COVID viral activity levels for COVID-19 is low, flu A is low, flu B is low, and RSV is low at this time. Taking a look at the air qualities in the United States, if this loads, and while we're waiting for this to load, let's pause and take a hydration break. We haven't done it in a few days. Juice is the drink of choice today. Long story as to why it's juice. I'm not going to sit here and bore you with the story, but I'll just tell you, to make a long story short, we actually have to have a repairman come out for a refrigerator. Of course, it is always a good idea. If you have to have a serviceman come out, always important to mask. And we tried to fix it ourselves first off, but yeah, we have to have a repairman, so the water line shut off, and I like to drink the water from that. I guess I could drink bottled water. We do have it, but I chose to drink juice today. We have problems in the West Coast. Take a look at this. Oh, and someone's probably wondering, will he have air purifiers going? Yes, the air purifiers will be on whenever they should come back. They already came once. They got to come back. Take a look at this. Speaking of air purifiers, if you live in Idaho and you have air purifiers, you may want to get them going, like Boise, Idaho, even in Washington State, Spokane, Washington. Yeah, take a look at this. Bad air qualities. I'm assuming this is a new wildfire. Oregon, you got problems as well. We could use some rain on the West Coast in general could really use a dose of rain. I don't think there's anything coming anytime soon. North of San Francisco, west of Sacramento, bad air qualities there as well. Not good. Still some problems in Colorado, though not as bad. And things are not too bad in the east right now. Taking a look at Florida, we're still seeing Pinellas County, Florida, show some sick person calls. I looked at this earlier. This video was supposed to be recorded several hours ago. Not going to get into why it got delayed. Noise interruptions outside, always the case. But take a look here, sick person calls. I've been noting this. That's still happening there. So, yeah, COVID may still be a problem there because it's been pretty much matching what wastewater's doing. Those calls have been going up when wastewater's been up. Philadelphia on Thursday, 761 total EMS calls. And get this, we have a surprise. Haha, Philadelphia did update. Now, this is saying August 14th. You and I both know, I'm pretty sure I showed this one day last week, that it did not update. Okay, well, it did at some point. And the good news is Philadelphia's not doing bad. But, take a look at this. On August 3rd, there was just one new hospital admission. Yeah, I mean, take a look at some of these states. There's just one. I'm not understanding that. I don't think all the hospitals are actually testing for COVID, but let's see. Wastewater would tell us if that's actually the case. And, well, here's what wastewater shows. Very minimal rise. There is a little bit of a rise here in Northeast Philadelphia. We actually had a neighbor that was sick for the whole month of July. I found out it was COVID. The whole month. She's immunocompromised. Has COPD. It's scary, man. She said it was bad. I heard say that it was lost of sense of taste and smell. Take a look at this. Not that bad. But the Northeast, that's our region here where I am, it was up ever so slightly. But you notice here, not as big as what we saw last summer. Nothing near the size of the wave we had in the wintertime. Some of the winter wave being oh so bad, that may have protected us from getting real bad this summer. But you know what? Philadelphia School District, and I know I got a few other people that watch my channel from Philadelphia. Philadelphia School District is going back next week. We'll have to see what the September report shows when we get to the mid-month of September. Take a look at this. Montgomery County, Pennsylvania. We're seeing respiratory emergency 1, 2, 3 times right now. 16 total calls. Yikes, that looks to be busy. Take a look at Chester County. Sick person is showing up there. Bucks County this afternoon. Really busy earlier. 14 calls. That's a lot for there. I got to refresh this. Is that still the case? They're still seeing 8 calls, and I have been seeing an increase of what they call, not respiratory emergency, but they call respiratory distress. Take a look at the hospital situation. Unless this has changed, and it hasn't, really going well in Pennsylvania today. Just 2 hospitals in the Lehigh Valley with problems, and Paoli Hospital, emergency department overcrowding, but that hasn't updated since the 20th. That's been a problem since we started using this dashboard, where that hospital sometimes will not update. New Jersey, unless something has changed. Yeah, something has changed. Capital Health Regional Medical Center is now dealing with patient volume. They are still accepting trauma patients and a couple other things. And we also have a psychiatric issue at Penn Medicine, Princeton, psychiatric issue at University Hospital. Okay, I looked at this 2 hours ago. Every hospital was listed at normal. A little bit of a change there. New York State today, 523 new cases and of COVID. And COVID hospitalizations, they have gone up slightly now to 381, which is a summer wave high for New York State. And 51 people in the hospital. Maybe we'll look at some other regions of New York State over the weekend. All right, when I say viruses are out of control today, COVID's still out of control. Take a look at this. Emergency department visits diagnosed with COVID. They're continuing to go up. And look at the end there. It's really starting to spike upward or climb upward. So, yeah. And take a look at this. When I say really going upward, it's now a 7-day average is now at 1.24. The most recent day was 1.35. And take a look at this. We are now approaching and about to pass the peak of that winter surge that we had. So yes, this is starting to become a little more serious than what we saw during the winter time. Will levels remain elevated as long as the winter time? I don't know, because you can see in the winter it did go up and then it went back down. Then it kind of leveled off before it dropped more. We'll have to see what the fall brings. All the fall activities could all lead to potential COVID cases. All right, take a look at this. Due to a technical issue, wastewater data is currently delayed for COVID-19, influenza A, and RSV data. It will be updated as soon as possible. This being the CDC Dashboard. But we do have this from the CDC. We can take a look at epidemic trends. The majority of the country is now in the growing phase. California, Washington, Oregon, Idaho, Nevada, Arizona, New Mexico, Colorado, South Dakota. Excuse me, no, not South. South Dakota is likely growing. Nebraska, Kansas, Texas. You get the point here. There's a lot of states here that are continuing to grow. Not changing in Alaska. No estimated whatsoever for Hawaii. We haven't seen anything from either of those 2 states for some time. Not changing in New Jersey. I don't know if I'm agreeing with that because New Jersey said they're seeing a slight increase. So you would think a slight increase would lead to likely growing, but it doesn't. I don't know. All right, quickly take a look at what's going on with wastewater scan. The West Coast is listed at medium. The rest of the country is high for COVID at this time. We will take a look at some more individual wastewater sites over the weekend. We'll probably have some data from CJS tomorrow. We will also do emergency department visits diagnosed with COVID. And then on Sunday, maybe we'll do that vlog where we recap the news stories of the week and do a whole bunch of wastewater scan wastewater sites. Unfortunately, we won't have CDC data. And then maybe some other dashboards. Alrighty, folks, that does it for the Friday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And if you do leave a comment, please let us know where you are from. I like to see the different areas because then I can do research on those areas to see if there's any news stories. And of course, ways to support my channel are listed down below. See everyone again tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Friday night and have a fantastic weekend. Stay safe.